What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer weight management, hormone pellet therapy, intimacy solutions, laser hair removal, weight management, and total wellness solutions, as well as, and most importantly, gynecology for women and adolescents. Our goal is to help you live well, age well, and experience everlasting intimacy. So today we're going to talk a little bit about feminine health, intimacy health. I have to change the words up for Facebook. And we're going to talk about sexually transmitted infections and why it's important to screen whether you think you are in a monogamous relationship or not. Okay. So there are several infections that can affect women. Let's talk about the ones that are not necessarily contracted sexually, but can be a cause of your feminine hygiene. So for one, we know bacteria vaginosis, you're more prone to it when you are sexually active, but it's not necessarily caused by intercourse, but you're more likely to get it if you are active. And that has a lot, good morning, that has a lot to do with your pH balance. So remember, using a Dove White Bar sensitive skin, so the original or the sensitive in the white and blue box or the white and green box. And again, it has to be a bar that's going to help with your pH and not using anything else. So no feminine washes, none of the great new things that are out there to help with your feminine health. All you need is that Dove White Bar sensitive skin soap. And remember, you need to treat the vaginal tissue to prevent dryness and urinary symptoms. So bacteria, vaginosis, and yeast are not really sexually transmitted infections, though they are increased, and the likelihood of you getting them is increased once you become sexually active. One of the most common sexually transmitted infections for women around 30s, 40s, 50s, 60s, 70s would be trichomonas. So trichomonas is an infection that is caused by having intercourse, okay? So men don't usually show up positive for it, but they need to be treated because they can spread it back and forth, even though their testing may come back negative. So if you have trichomonas, that means that whoever you were sleeping with, somehow gave you trichomonas, whether that was your partner from, a couple of weeks ago, or whether that was a partner from a couple of years ago. I have actually seen women who have not had intercourse in 3, 4, 5, 6 years, and they come in and hadn't been getting their pap smears. That's another conversation. And so we find it on a pap smear, we treat it, and it's gone. So it's one of those things that can linger. A lot of women don't notice the negative symptoms, which can be an abnormal colored discharge, some irritation, and it can also have a funny smell. So that's one of the most common ones for our age group. For our younger ladies, then chlamydia is one of the most common. Chlamydia does not necessarily have symptoms. So that's why it's important to screen for it, no matter how old you are. So I'm a grown, happily married woman. I work with my husband all day. When I have my annual exam, I get all of my screenings, including chlamydia, gonorrhea, and trichomonas. Whether I think my husband is doing something or not, it's important to get your screenings for your pap smears, because that is human papilloma virus, which can be transmitted sexually and can be transmitted not sexually as well, but it's still a virus. We screen for that to prevent cervical cancer. You need to also screen for these other infections, because chlamydia can actually cause women to be infertile, okay? Because it can travel up to the tubes. It can cause what we call pelvic inflammatory disease. It can cause scarring of the tubes, which can decrease the chance of you getting pregnant later in life, which is why, young ladies, it is so important to use condoms, because men don't know that they have chlamydia, or boys don't know that they have chlamydia when they are intimate with you. You get it. You may not know because you don't notice any symptoms. You just happen to go to the doctor, get your normal screenings, and we treat it. And the sooner we treat it, the less likely you are to get pelvic inflammatory disease. Another one is gonorrhea. Most women are going to notice some symptoms with that, because that's going to be an abnormal discharge. Sometimes it's going to include some cramping and some discomfort. Chlamydia and gonorrhea can cause some spotting in between, or spotting after intercourse. Usually there is a difference in your normal vaginal odor. But again, screening is imperative. So when it's time for your pap smears, your screening comes with your paps. So if you still have a cervix, you should be screening for chlamydia as well as gonorrhea. If you don't have a cervix, you don't have to screen for chlamydia or gonorrhea because you can't get chlamydia or gonorrhea without a cervix. However, you can still get trichomonas, so you should be screening for that, even if you've had a hysterectomy. So those are more of your vaginal infections. The other things that we screen for on an annual exam for sexually transmitted infections is HIV. You don't know you have HIV unless you're getting screened. I don't care. I am in a monogamous relationship with my husband. We work together. We're together all the time. I still get my HIV screenings on a regular basis. So you don't have symptoms with HIV. It's something that's easily treated now, but you have to know you have it in order to treat it. So that's why it's important to still get your screenings. It's important for you to get a hepatitis C screening. So that's one of our basic screenings with an annual exam for a woman, because you may not have symptoms. It spreads sexually, and it can cause liver cancer down the road, and it can cause problems with your liver, cirrhosis. So you should be screening for it because it is sexually transmitted. And now there is this whole, needle use thing where a lot of people used to get it through needle use. Well, people are going back to using needles now. And of course, if you work in an environment where you can easily get stuck by a needle, nurses, doctors, medical assistants, you want to make sure that you're getting your screening for hepatitis C. Hepatitis B can also be spread that way, but most of us have vaccines for hepatitis B if you were born in America. And if you worked in the healthcare field, you probably got your vaccines. And now most people are going to get those vaccines if their parents allow them to have their vaccinations. And then finally, syphilis. So we do a RPR test to make sure that that's negative. Sometimes you can get a false positive. Most of the time that we get a positive, I would say it's probably a false positive, but we can easily rule that out with a follow-up test. And all of these things can easily be treated. So it's important to know whether you have them so that they can be treated as quickly as possible so that they don't negatively affect your health in the long run. So just like you should be getting screened for pap smears to prevent cervical cancer, young ladies, you should be getting screened for your chlamydia, gonorrhea, trichomonas to prevent infertility, and pelvic inflammatory disease. And pelvic inflammatory disease can definitely cause you to get sick, which is why I'm going to hit on contraception just a little bit, which is why one of my most favorite birth control or contraception options for young women is the Liletta or Mirena IUD. They last for 8 years now. We place them in the office. They have progesterone in them. So if you have a history of a blood clot, heart disease, you can use the progesterone IUD. If you have a history of breast cancer, we do not want you using any progesterone or any estrogen ever. But if you've had a blood clot, heart disease, high blood pressure, and you can't use the estrogen and in your birth control, you can still use the IUD, and the IUD can actually control you, keep you from getting pregnant, but also it can protect your tubes. So that's why I like it for my young patients. So when my daughter goes off to college, she's going to have a Liletta or a Mirena IUD in, because one, I know it lasts for 8 years. Two, I know it's going to protect her tubes if she does make bad decisions, because she is human, and she happens to sleep with someone who gives her a sexually transmitted infection. I know that I'm protecting her fertility. Three, we are losing all of our reproductive rights in Alabama and in the United States of America. So I think it's very important for young ladies and women who don't want to get pregnant to have contraception that they can rely on. It's not dependent on them remembering to take something. It's effective. Everything has a very small failure rate, but the IUDs are going to have less of a failure rate than something like a birth control pill or a NuvaRing or a patch, because the physician or the provider actually places it, and you don't have to remember to do something every day. The other thing I really like about the IUD is that it helps control bleeding. So it usually decreases the amount of bleeding, sometimes the frequency of bleeding. Sometimes women don't have a cycle at all. And remember, it's okay to not have a cycle as long as you're on some kind of hormonal birth control that's stopping your cycle. If you're not on birth control, it's not okay for you to not have a cycle when you are premenopausal, meaning your FSH is still low, you're still producing estrogen and progesterone. We want you to have regular cycles. If not, you need to see your doctor, talk about it, and figure out what's going on with your hormones so that we can get that fixed. But today, the point was sexually transmitted infection awareness. The only way that you know you have many of these sexually transmitted infections that can easily be treated is if you are screened. Now, the last one I want to talk about is herpes. Herpes is one of the most common sexually transmitted infections. It's an actual virus. And the reason it's so easily transmitted is because it's so rampant in the population. So anywhere from 35 to 45% of the population has herpes, depending on age, depending on where you live, depending on, whatever. It doesn't mean you're promiscuous because you have herpes. You could have slept with one person a long time ago and been exposed to it. You have something going on with your immune system. You're sick, you're stressed, and you get a lesion. That lesion is usually on the vulva. That lesion is going to be very painful for the first outbreak. It's going to usually start hurting before you see it. It can come as one little blistered area, or it can come as a several little blistered areas, but you can barely touch them, and you want to jump off the table, especially during that first outbreak. Again, 35 to 45% of the population has herpes. It's easily spread because you can be contagious with the herpes virus even if you don't have a lesion, because you can start shedding it before you actually see the lesion. So the best way to prevent the spread is to prophylactically take acyclovir or Valtrex so that you're less likely to spread the virus to somebody else. It is one of those conversations that you should respectfully have with your partner. There is a large chance that your partner already has herpes. It's not something that I just blindly screen for. And the reason I don't is because it's so rampant in the population. So many people have been exposed, but it's not going to affect you if you've never had an outbreak. So I don't just say, when people say, I want to get screened for everything, what I say is, if you get a lesion on your vulva, let's take a sample of that lesion and send it off. And that way we know whether you have herpes. But I don't just take my women and blindly screen for herpes, because there's a HSV1, which comes from the mouth, cold sores. There's also a HSV2, which usually starts more in the genital area. But now, because so many people have oral intimacy, you can see HSV1 or HSV2 everywhere. So, so because of our sexual practices, which is nothing wrong with that, HSV1 and HSV2 is everywhere. But what I like to remind everybody, since I get a lot of young women who come in and they are just devastated, they have extreme anxiety, they've gone to another doctor that makes them feel like they're nasty or they're promiscuous, and that's why they got it. They do the same thing for HPV, which could cause cervical cancer, which we are screening for consistently with your pap smears. None of having HSV or HPV, so herpes or HPV, the virus that can cause cervical cancer, means that you are promiscuous or means that you have been with somebody dirty or nasty. It's a virus that's rampant in the population. It's easy for you to be exposed to it. So the main thing is getting your screening. If you see a lesion, it hadn't been there before, it's painful or uncomfortable, or you're noticing a lesion can come back and forth regularly, get it screened, get a culture of that lesion while it's there. Let them send that off so we can determine whether you are actually having herpes outbreaks. And if you are, we want to treat the outbreak, and we want to prophylactically treat you so that you don't continue to get the outbreaks, which can be uncomfortable. They won't make you die, but it can change how you deliver your baby. So if you have an active herpes infection, we don't want you having a vaginal delivery. So that's why for most women who are pregnant, we have them to go ahead and take the medication prophylactically to decrease the chance of them having an outbreak when it's time for them to deliver. So they're more likely to be able to have a vaginal delivery if that is their desire. And we always usually check if you have a history of herpes before you actually have a delivery. When you come in for labor and delivery, we used to always just take a peek, make sure there were no active lesions. If they weren't, you can go ahead for a vaginal delivery. If they are, we recommend a C-section, because herpes can be spread to the baby and affect the baby negatively. So again, screening is everything. Going for your pap smears to prevent cervical cancer. HPV can be sexually transmitted, but also our women who are 21 years old and have never had sex, we still do a pap smear, because even though they may not have been sexually active, they still could have been exposed to that virus. So we want to know about the exposure so that we can prevent cervical cancer, because if you have an abnormal pap smear, that's not a big deal at all. The big deal is if you have abnormal cells on your cervix and you don't know it because you're not getting your pap smears, or you had an abnormal pap and you didn't follow up. And so now it's progressing to something worse. Usually when we find HPV and you have a slightly abnormal pap, You end up coming to see us a little bit more frequently at the office. It's nothing to be afraid of as long as you follow up. And the other thing you can do is not smoke. So, not smoking cigarettes will help you to get rid of the virus faster. So if you're a smoker, stop smoking, get your regular pap smears, follow up after an abnormal pap smear as frequently as we tell you to, and we can prevent cervical cancer. Again, chlamydia, gonorrhea, trichomona. Sometimes women don't have symptoms. Sometimes men don't have symptoms. If you have one of those diseases, you got it sexually. You did not get it off the toilet seat. You did not get it because you used somebody else's soap. You got it because you slept with someone who gave it to you. You need to figure out who that is so that they can get treated. And then you need to make sure that you're using condoms and being safe, because especially in my younger population, chlamydia and gonorrhea rates are very high. So we need to be safe if we're going to be sexually active. We talked about contraception. A great form of contraception to prevent PID and infertility when exposed to a sexually transmitted infection is Liletta or Mirena. Those are the IUD forms that have proven to decrease the risk of pelvic inflammatory disease, which decreases the risk of infertility. Getting pelvic inflammatory disease and chlamydia and gonorrhea not treated that spreads up to the tube definitely increases your risk of infertility in the future. So to prevent that, when you go to the gynecologist, you have your annual, get the screening. I don't care how great you think your husband is. I don't care how great you think your boyfriend is. If you are sexually active, you could have contracted one of these infections at some point. So get your screenings. It's not going to hurt you. And most of the time, if your insurance pays for an annual, it's going to pay for your screenings. And some things are just worth the investment to take care of you. So, and remember, most of my married women who have a positive test didn't think that their husband was necessarily cheating on them. Now, there are some women who come in because they know that there's something going on and that they think that their husband may be stepping out, and they come and get it. But this is a screening that every woman should get, no matter how great you think your relationship is. Screen so that you can take care of yourself, especially when you're talking about HIV, hepatitis C, and syphilis, and also those vaginal infections that we can screen for with the culture or urine culture or vaginal culture. So it's Dr. Mia at Mibella Wellness Center. You know, I am your B3 specialist and board certified gynecologist right there at Mibella Wellness Center, where we offer gynecology to women and adolescents. We are taking new appointments. We have 2 additional providers who are absolutely amazing. That would be Brittany Wynn and Valerie C. So I have a great team of people who can take care of you. Of course, the whole Mibella team is going to take care of you and give you a great experience when you come. We don't just focus only on gynecology. We focus on prevention. We focus on screening and wellness, including sexual health. So making sure that we are continuing to keep a healthy vaginal environment, preventing and treating sexually transmitted infections, and screening for those diseases that can negatively affect us. We also have hormonal balance with hormone pellet therapy and hormone creams so that you can live well and age well as you transition through the different phases of life. We want you to have everlasting intimacy, so we have some great intimacy services. And even during your gynecology appointments, we tell you how to prevent problems with your sexual function in the future. We also have weight management, because we know the key to real health is maintaining a healthy weight. And we know that so many disease states are increased by being overweight or obese. We know it is difficult to lose weight. Nobody's really taught us how to live this healthy lifestyle to prevent disease. That is why we are here to help you with provider-directed weight management, where we have been trained on behavior modification, nutrition, as well as hormonal balance, which all affect weight management. We have total wellness with supplements for prevention as well, and the treatment of disease. God put a lot of plants on this earth that can be used to treat us and keep us healthy. And finally, we have laser hair removal. As we age and mature, hair comes in all the wrong places and leaves all the wrong places. So to prevent that hair on the face and to stop it from being an issue, we do have some great laser hair removal procedures. We take care of women and adolescents, and we also take care of men. So I hope that y'all go have a phenomenal weekend. Look forward to seeing you on tomorrow for Ageless Intimacy with Dr. Mia and Joseph. I forgot what we're talking about tomorrow, but it's something good. So you want to be there at 8:30. Also, Tuesday, make sure you register for the event, the webinar. We'll be talking about menopause. osteoporosis and weight management. This is our month of a lot of weight management deals, and we're super excited about the month to come in May. I'm going to be coming to you live every Saturday morning, either on a webinar that you'll have to register for, or right here on Weekly Wellness with Dr. Mia. So I look forward to seeing you. Go live well, age well, and experience everlasting intimacy. It's Dr. Mia. See y'all later, and thank you for joining. Go share. This is great information that we should all be sharing. Of course, at Me Bella, our other goal is to educate the community. It is our responsibility to educate the community, and that's how we're going to live this life of wellness. So go do it. It's Dr. Mia. Bye. Thanks for joining. Happy Saturday.